Do you have pain with intercourse and does it feel like it's deep? It's called Deep Dyspareunia. Here are 8 reasons why you might be having pain deep inside the vagina. The first reason is cervical pain, and this is when the cervix itself is sensitive, especially after having an IUD put in, or it might not be sitting correctly, or if you've had a LEEP procedure, and so the cervix does not want to be bumped because it's irritated. The second reason is called endometriosis, and this is where the lining of the uterus can migrate into other areas of the pelvic cavity, and it's believed that about 10% of females have this. It's associated with very painful periods, sometimes painful ovulation, can be painful with bowel movements, and also pain with penetration. If you do have this, the treatment often consists of pelvic floor therapy and sometimes also medication. The third reason is ovarian cysts, which are very common. We often have small cysts on our ovaries, but when they're larger cysts, they can leak fluid and become inflamed. And during penetration, if that area is getting jiggled and wiggled about, it can irritate them, and then you have quite a deep ache that can last for some time afterwards. The fourth reason is fibroids. Now, fibroids are very common. About 3/4 of women will grow them at some time during their life, and they can be very small or quite large. They're benign growths, so they don't cause cancer in the uterus. And larger ones can create some problems such as a sensation of heaviness, a lot of menstrual bleeding, a long menstrual cycle. They can create urgency, where you feel like you have to go pee all the time. They can disrupt your normal bowel function, and of course, they can cause pain with intercourse. So if you have symptoms where you're bleeding for long periods of time, or you have a pain in your lower abdomen that just won't go away, urgency, then please contact your healthcare provider. Did you know that not all of us have the same position of where our uterus is sitting? And that's reason number 5. If we have what's called a retroverted uterus, some positions during intercourse can be quite painful because it gets knocked about a little bit more. Reason number 6 is bowel pain. If you have IBS or irritable bowel syndrome, Crohn's disease, ulcerative colitis, when you're having penetrative sex, the rectum gets moved because it sits right next door to the vagina, and this can flare up your symptoms and create a deep ache during intercourse. Reason number 7, pelvic inflammatory disease. This is often associated with sexually transmitted diseases or having bacteria come up through the vagina onto the cervix, such as when you have an IUD placed and there's bacteria on it. Most of the time, most women in their late teens, early 20s are those that will have pelvic inflammatory disease. And the last reason for deep dyspareunia is bladder pain. This can happen with penetrative sex when the bladder is getting bumped, because the vagina and the bladder are, again, right next door to each other. If you have something such as interstitial cystitis, or if you have a bladder infection, you can have a deep ache in the pelvis for quite a long time afterwards, like several hours or even days afterwards. I hope this video has helped you figure out why you might be having pain with intercourse and why it feels deep inside. Do know that the reasons that we've given today, that these can be treated. You can go to your healthcare provider now with a little bit more information and hopefully get the treatment that you deserve. So all the best with that.